Androgen insensitivity syndrome, or AIS, is a genetic condition that affects how the body responds to androgens. Androgens, like testosterone, are a group of hormones crucial for male sexual development and play a role in both male and female health. In AIS, individuals who are genetically male, meaning they have an X and Y chromosome, are unable to fully respond to these hormones. This leads to a range of physical characteristics, sometimes resulting in a female appearance despite having male chromosomes. AS is caused by a mutation in the AR gene, which is located on the X chromosome. This gene provides the instructions for making the androgen receptor, a protein that binds to androgens like testosterone inside cells. When the AR gene is mutated, the androgen receptor either doesn't function properly or isn't produced at all. Because the AR gene is on the X chromosome, a male with a mutated AR gene will always have AS, as they only have one X chromosome. Females usually won't be affected by the condition, though the possibility of having mild symptoms exists, as they have two X chromosomes and can carry a normal copy of the AR gene. Normally in a developing male fetus, androgens, especially testosterone, bind to their receptors, triggering the development of male characteristics. These include the development of the testes, the descent of the testes, and the formation of male genitalia. In AS, the mutated androgen receptor cannot effectively bind to androgens. This disrupts the normal development process. The degree of disruption depends on the severity of the mutation. The body might convert some of the androgens into estrogen, further promoting female characteristics. Internal male reproductive organs, such as testes, are present, but they are usually undescended, residing within the abdomen or inguinal canal. The development of external genitalia can range from completely female to ambiguous, or partially male, depending on the specific type and severity of the syndrome. AIS is a relatively rare condition, with estimates suggesting it occurs in approximately 1 in 20,000 to 1 in 64,000 male births. It is important to note that this number may be an underestimation, as milder forms of AIS may go undiagnosed. The prevalence of AS does not vary significantly among different ethnic or racial groups. The signs and symptoms of AS vary widely depending on the severity of the androgen insensitivity. In complete androgen insensitivity syndrome, or CIS, individuals typically have a female appearance. They may have normal breast development, sparse or absent pubic and axillary hair, and a shortened vagina. They will not menstruate. Individuals with partial androgen insensitivity syndrome, or PIS, can have a range of features. These might include ambiguous genitalia at birth, such as an enlarged clitoris or partially fused labia, or they might develop gynecomastia, or breast development during puberty. Mild androgen insensitivity syndrome, or MIS, may have subtle signs such as infertility or mild gynecomastia. Diagnosis of AOS typically involves a combination of physical examination, hormone testing, and genetic testing. A physical exam can reveal the presence of ambiguous genitalia or other characteristic features. Hormone testing, specifically measuring levels of testosterone, luteinizing hormone, and follicle-stimulating hormone, can provide clues. Elevated testosterone levels in a person with a female or ambiguous phenotype can raise suspicion. Genetic testing, specifically analyzing the AR gene on the X chromosome, confirms the diagnosis by identifying the presence of a mutation. AIS is broadly classified into three main types: complete androgen insensitivity syndrome, or KAIS, where the body is completely unable to respond to androgens, resulting in a completely female phenotype; partial androgen insensitivity syndrome, or PIS, where there is some response to androgens, leading to ambiguous genitalia or a mix of male and female characteristics; and finally, mild androgen insensitivity syndrome, or MEMIS, where there is a slight reduction in androgen sensitivity, which might result in only minor physical differences or infertility. Treatment and management of AIS are tailored to the individual's specific needs and the type of AIS they have. For individuals with CS, treatment often involves gonadectomy, or removal of the testes, typically after puberty, to reduce the risk of cancer development. Estrogen replacement therapy is usually initiated after gonadectomy to promote the development and maintenance of female secondary sexual characteristics and bone health. Vaginal dilation may be necessary to create a functional vagina. Individuals with PIS may require surgical intervention to correct ambiguous genitalia. Hormone therapy, either estrogen or testosterone, may be used to optimize physical development and sexual function. Psychological support and counseling are crucial for individuals with AIS and their families to address the emotional and social challenges associated with the condition. This counseling often addresses issues of gender identity, sexuality, and reproductive options. Currently, there is no known way to prevent androgen insensitivity syndrome, as it is a genetic condition caused by mutations in the AR gene. Genetic counseling is recommended for families with a history of AIs. This can help prospective parents understand the risk of having a child with AIs and explore available reproductive options, such as preimplantation genetic diagnosis. The prognosis for individuals with AIs is generally good, especially with appropriate medical management and psychological support. Individuals with CAs can live fulfilling lives as women with hormone replacement therapy. The long-term prognosis for individuals with PAIs can vary depending on the severity of the condition and the effectiveness of treatment. Recent research is focused on developing more targeted therapies that can improve androgen receptor function in individuals with PAIs. Gene therapy is a potential future treatment option, but it is still in the early stages of development. Researchers are also investigating the role of epigenetics, which can influence gene expression in the development of AIs.